Friends, Dr. Manish. Today I'm going to speak to you about acne or pimples. So mild kind of acne is in a normal language, we call them pimples. Acne is a typical presentation of nodule, papules or a kind of cyst on the skin. But mostly acne affects people on the skin but not on face. Once it comes to the face, the patients are conscious, they come to us, but acne is more than face. The basic predisposing sites of acne are the shoulders, the back, the thighs, and other parts of the body, sometimes in the groins also. A major disease which simulates acne is called hydradenitis. So whenever the acne like cyst comes up, it is very important to understand what may be the cause of it and whether it is acne or pimples. So to meet a doctor is important. Second is you must take a good care of your skin when you have acne. People do start scrubbing, they start using different kind of masks which are in the market, and they start scrubbing lots of chemicals on the skin like digoxide, like peroxides, like different over-the-counter products of fairness, or at times they use sulfur. But I digress from using such things because once your skin becomes irritated, the acne and the skin blemished, and that results into a bad texture of your skin. So acne is a kind of challenge at a age when you are developing into adolescent and you develop a new hormones in the body, male, female alike. But if in case it continues beyond the age of 20 years, then that requires to be found out, and the doctor is required to understand the disease and recover the disease. In medical science, acne, there are lots of dermat treatments, right from laser therapies to anti-inflammatories to local applications to steroids to antibiotics. Lots of drugs are there for skin, but at last, if you see the patient, they develop a small poking on the skin becomes worse because any chemicals which you take with the dermat may help you in a simple case of acne when your immunity is good, but in long run, if you have a recurrent acne bouts and you take antibiotics, the skin becomes resistant and the bacteria or the yeast or the unicellular infective organism, they become resistant to the medical usage of the drugs, and that causes a very big cyst, bumps or a kind of pus which do not goes back. So acne is of 4 types: open comedones, closed comedones, cyst and simple papules. So papules is a small eruptions, pimples like. There are open comedones which we call blackheads and whiteheads. So one is filled with the cheese and dirty material, but it is open, so it is a blackhead, and or it's called closed comedones. And the one is which is open up, but there is lots of dirtiness around it, and a putty is enclosed, that is called open comedones. So black whiteheads are the major problem with acne, and acne is a curable entity. If you come with a Homeo-dermatology, the treatment is very simple. We diagnose it as per the simulum therapeutics, and the radar of treatment is biomarkers, your immunity, and homeopathy once comes inside, the treatment results into a recovery, slow recovery but definite recovery. The condition comes down in a cycle and goes down completely without leaving any scars, and the best thing is that it is 100% safe and effective. It is safe, no chemicals. Homeopathy is a therapeutics which works on a drugless therapy. So there is lots of usage of yoga and good diet and your strong affirmation in the treatment. A holistic treatment makes your immunity up, so you don't get only benefit for acne, but there is a collateral advantage of a treatment. But in most of the chemistry and dermat treatment, there's a collateral disadvantage of a treatment which is not in Homeo-dermatology. So I would recommend friends to come up, show me up, consult it. I'm sure that this treatment is very effective and will help you out. And if you like my understanding and if you like my show, do not forget to like, subscribe and share with your friends. आपके अंदर बैठे ईश्वर को मैं नमन करता हूँ.